Welcome to this presentation, Shedding Light on Dementia, a growing public health concern in Canada and around the world. Personally impacted by an early-stage diagnosis, I embarked on a journey of research to understand how this condition will shape my life. Join me as I share my findings and insights into navigating life with dementia. Prevention refers to a diverse range of measures, interventions, programs, policies, and legislation aimed at preventing the occurrence or progression of diseases and minimizing the risk of harm, injury, disability, or death. These endeavors are geared towards improving, preserving, or restoring the quality of life in terms of health throughout an individual's lifetime. The levels of prevention have evolved over time. Currently, there are 5 levels of prevention, which include primordial, primary, secondary, tertiary, and quaternary. Dementia is an umbrella term encompassing chronic and often progressive neurological disorders leading to the deterioration of mental processes and is a significant contributor to death, disability, and hospitalization in Canada. Dementia is caused by damage to brain tissue, loss of neural connections, and the formation of tangles, twisted tau protein threads, and plaques, abnormal amyloid protein clusters in the brain. These changes can arise from various diseases and injuries that affect the brain. According to the Alzheimer's Society of Canada, over 700,000 people in Canada have dementia, and this number is expected to increase to over 1.7 million by 2050. Globally, there are over 55 million people with dementia and is estimated to rise to over 139 million by 2050. The economic burden of dementia in Canada was $40.1 billion in 2020 and is estimated to increase by 275% by 2050. In 2020, the global cost of dementia was $1.3 trillion US, and it is expected to more than double by 2030. Prior to the early 2000s, detecting dementia was only possible through postmortem autopsy. But today, researchers have developed tests to identify biomarkers associated with dementia in living individuals. Biomarkers are valuable tools for secondary prevention through early detection of neurodegenerative diseases and tertiary prevention through assessing the impact of experimental medications. There are 4 types of biomarker tests. 1. Brain imaging can detect beta amyloids and abnormal accumulation of tau proteins, which are hallmarks of Alzheimer's disease. 2. Cerebrospinal fluid biomarkers, CSF, also measure beta amyloid and tau proteins. 3. Blood tests measure proteins that originate in the brain but are less accurate than CSF. 4. Genetic testing involves analyzing DNA extracted from blood or saliva. Here, we have a chart depicting the signs and symptoms of early and late-stage dementia, highlighting the differences in memory, mood, sleep, and movement. As part of primordial prevention, through policy and legislation, Canada's commitment to dementia care is showcased through the development of the National Dementia Strategy. The NDS focuses on increased awareness, funding research, encouraging healthy practices, enhancing assistance, and tracking statistical developments. On June 22, 2017, Canada was the 31st nation to launch its own NDS, ensuring tailored care for the diverse population, with 12 public health policy initiatives in focus. The strategy demands exceptional government collaboration, given that Canada's healthcare system is under provincial and territorial responsibility. Because of Canada's diverse demographic, there is a need for attention regarding Indigenous communities, which are often overlooked in research and development, perpetuating inequality. The next step is an action plan to turn the commitment into tangible improvements. Canada's key objectives are to prevent dementia, advance therapies, and improve the quality of life for dementia patients. The 5 principles that support the strategy include prioritizing quality of life, respecting and valuing diversity, upholding human rights standards, remaining evidence-informed, and results focused on progress. Implementation of the NDS can commence through collaboration, research and innovation, surveillance, information resources, and a skilled workforce. Some potential key stakeholders include federal government ministries such as Indigenous Services and provincial representatives such as the Canadian Institute of Health Research and Alzheimer's Society of Canada. This chart, adapted from the Canadian Institute of Health Information, demonstrates that most Canadian seniors live at home. In total, about 61% of seniors with dementia in Canada live at home and require support. Those living with this disease desire their independence and social networks, which require comprehensive at-home care and community support for the patient and caregiver. As part of the tertiary level of prevention, there are approximately 500,000 caregivers for dementia in Canada. Dementia caregivers tend to be more burdened, and 45% compared to 26% of other caregivers will experience distress. Overall, the top noted concerns were feeling worried, anxious, being tired, plus having sleep disturbances, feeling overwhelmed, being depressed, and a decrease in healthy behaviors such as less exercise and unhealthy diets. Socially, there is less time to spend with family and friends, creating isolation and less time to do things you like. Employment can be affected by absenteeism, reduced hours, leaves of absence, or the necessity to quit. Half of all caregivers report financial burdens, and it is estimated that they spend up to $1.4 billion per year out of their own pocket. Thank you for joining my presentation. My sincere hope is that the insights shared today will serve as a valuable resource for individuals affected by dementia. Let's navigate this journey together with compassion and understanding.